Today we'll be demonstrating IV push medications.
Okay, so today I have a patient who has been experiencing some pain and discomfort. So they had their call light on, so I walked into the room, asked them about their pain. They're asking if they can have some more morphine, if it's time for some more. So I need to do an assessment on this. First thing I'm going to do is look at the MAR to see if indeed they can have some, because the MAR says that they can have morphine, 2 milligrams, IV push every 4 hours, PRN, severe pain. So it has indeed been past 4 hours. So I'm going to do a pain assessment using the PQRS-TU. I'm going to do all of that, and then I'm going to make sure that their IV site is appropriate. It looks good, no signs of infection or infiltration. And then I'm going to ask the patient if I can take their vital signs, because I want to make sure that their blood pressure is stable, their respirations are stable, their oxygen saturation is good, because I know that morphine is a respiratory depressant. So I want to make sure that it's pertinent for them to have this medication. So once I've determined all of that, I'm going to go into the med room and get my supplies. So once I'm in the med room, all my supplies are in this box or Omnicell. I'm going to wash my hands and put my gloves on. And the supplies that I have with me are a 3 ml syringe with a needle to be able to draw out the medicine, my alcohol swabs, and then a label to put on the syringe for when I walked to the patient's room down the hallway. So I'm going to open the Omnicell and I'm going to get the medication out. This is the first check. This is called pull. So I'm going to pull the medicine out. Morphine, 4 milligrams per ml. That's my concentration that I have. I also need to pull out 2 saline flushes. Because this is a saline lock, I need to flush the line first, give the medicine, and then flush the line again to get all the medicine into the patient's system. So that was my pull. The next thing I'm going to do is cleanse the top of the vial for 15 to 30 seconds. And I'm going to open my syringe. Make sure that's twisted on, take the cap out, put the cap into the bottle, the vial there, and I'm going to determine again how many milliliters do I need to pull up. So I see that the concentration I have is 4 milligrams per ml, but the dose that he's supposed to get is 2 milligrams. So that means I'm going to pull up half an ml. So I'm going to pull up half an ml of air, and I'm going to insert it into my vial. I'm going to flip it over, and I'm going to pull out the half of ml. Making sure that there's no air bubbles or any air space in there that would affect the dose. Okay, so there's my half of ml, and then I'm going to put the cap back on it. And now I'm going to pause. So I want to pause and make sure that I have everything I need before I go to the patient's room. Again, pausing means taking your medication, your MAR, and your syringe, if you have that, to confirm that you have the correct thing. So morphine sulfate, 4 milligrams per ml. I'm supposed to give 2 milligrams IV push every 4 hours. So if it's 4 milligrams for 1 ml and I have 2 milligrams, then I need to have half an ml in my syringe, which I do. So now that I've confirmed all of that, I'm going to take a label, a med label with my initials, patient's initials, the date and the time, and I'm going to take my medication vial because I need that for when I scan for my third check. And then I'm also going to take my 2 saline flushes. And then we're going to go back to the patient's room. So once we go back to the patient's room, of course, you would do you'd wash your hands, and I would verify my patient by asking them their name and their date of birth and confirm that with their ID bracelet that they have on. I would confirm that they have no allergies, of course, to the morphine, and that the morphine vial is not expired. So once I've done all of that, I'm going to explain to the patient, okay, I'm going to inject this medication into your IV, and hopefully that will help with your pain. And then I also want to make sure that after I give this, about 20 minutes later, I come back and do a post assessment, and hopefully that their pain is better. So before I do this, I just, again, want to check their respirations to make sure everything is appropriate, because as I said before, morphine is a respiratory depressant, so I know that I need to make sure their vital signs are stable. One thing with IV medications is different medications are meant to be delivered at a different rate. Some can be delivered quick, some have to be delivered slowly. So if I've never given morphine before and I don't know how fast to give this, I need to look up the information in this drug book. The general rule for morphine is 1 milligram a minute. So since I'm giving 2 milligrams, then I'm just going to give this slow IV over 2 minutes. So always make sure you know how fast or how slow to give any medication. So the first thing I'm going to do is open up my saline flush, and I'm going to pick up the IV, and you can see that it's clamped. So I need to unclamp that. And I'm going to take an alcohol swab, and I'm going to cleanse the site for 15 to 30 seconds. And then I'm going to pick up my saline syringe, but you can see that there's air in the syringe, so I need to always make sure I get that air out, because we don't want to inject the patient's vein with air. So now that the air is out, I've done my third check, which is my scan, and the saline says 2 milliliters saline lock flush. So I've done my third check, and I'm going to attach my saline to my Luer lock, and I'm going to inject 2 mLs of a saline flush. I'm watching the IV site. It's going in great. Doesn't look like there's any signs of swelling or infiltration. So I'm going to disconnect that. And then I'm going to get another alcohol swab and clean the site again. And then I'm going to get my morphine, and I'm going to take the cap, the needle off, and I'm going to attach this to the site. And as we said before, I'm going to give this 2 milligrams over 2 minutes. So magically, 2 minutes have passed, and the morphine is injected. Disconnect it. Cleanse the site again with another alcohol swab. Get another saline flush. Take the cap off. Get the air out. Again, flush for 2 mLs. Again, that just is flushing the rest of the remaining morphine into the vein. So once that's done, you want to clamp the line again. Look at the site again. Make sure that it doesn't look infiltrated, red, swollen, anything like that. Check with your patient. Make sure they're feeling okay. And then make sure you come back in 20 minutes to do a post-pain assessment. And that completes IV push medications.